My name is Nicole Aguirre. I'm currently doing my pediatric emergency room rotation, so I will be reviewing a case that I had this past week. This case is a 5-year-old female who presented to the ER this morning with the chief complaint of shortness of breath and difficulty breathing. The history of present illness. The patient presents with shortness of breath. The onset was abrupt and today. The course duration of symptoms is constant and worsening. Degree at onset, moderate. Degree at present, moderate. The exacerbating factor is none. The relieving factor is none. Risk factors consist of asthma. Therapy done today. Mother gave two albuterol treatments prior to arrival with no relief. Associated symptoms are cough. Mother denies fever or any other symptoms. Additional history per mom. Patient began with shortness of breath abruptly this morning. Gave 2 albuterol treatments from home neb with no relief and brought to the ER. The review of symptoms. The constitutional symptoms. Patient has no fever, no chills, no fatigue, no decreased activity. Skin symptoms, no rash, no abrasions, no lesions. Eye symptoms, no pain, no discharge, no ENT symptoms, no ear pain, no sore throat, no nasal congestion. Respiratory symptoms consist of shortness of breath and cough. Cardiovascular symptoms, chest pain, no diaphoresis. GI symptoms, no abdominal pain, no nausea, no vomiting, no diarrhea. GI symptoms, no dysuria. Musculoskeletal symptoms, no pain, no joint pain. Neurological symptoms, no headache. Endocrine symptoms, no polyuria. The health status. Patient does not have any allergies, does have a past medical history of asthma diagnosed 2 years ago. Father also has asthma. Patient's immunizations are up to date. No surgeries or hospitalizations. So after that information, my differential diagnoses for this patient were pneumonia, respiratory viral infection, and acute asthma exacerbation. So on further assessment for the objective assessment, vital signs, patient's heart rate was 141, respiratory rate was 40, O2 sats were 98 on room air, blood pressure was 99/70 with the 80 MAP, the temp was 99.1 orally. For the physical exam, general, patient was alert, in moderate distress and awake. Skin was warm, no rash, pale, no swelling, cap refill was less than 2. Head, no swelling, no arrhythmia. Neck was supple, trachea midline, no tenderness, no enlarged nodes. Eyes, pupils are equal round, reactive to light, normal conjunctiva. ENT, patient had moist mucous membranes, no pharyngeal edema or exudate. Tympanic membranes were normal. Nose was normal, external nose normal, and patent no discharge noted. CV, patient was tachycardic, but normal rhythm noted, no murmur, and peripheral perfusion was normal. On respiratory, patients had moderate distress, breath sounds bilateral, were wheezing on inspiratory and expiratory, poor air exchange noted. Patient did have moderate retractions, intercostal retractions, substernal retractions, and suprasternal retractions. GI was soft, non-tender, non-distended, normal bowel sounds. GU was normal, external genitalia, musculoskeletal, normal range of motion, no tenderness, no swelling, no deformity, cap refill less than 2 seconds, and neurological, alert and oriented to person, place, time, and situation, no focal deficits noticed, and normal speech observed. No lymphadenopathy, and psychiatric, cooperative, appropriate, mood, and affect. So after that, after the physical assessment, tests that were ordered, we ordered a chest x-ray. Labs that were done, we ordered a VBG, CMP, and CRP. And for medications, before any of that was done, we did do a duonev. We gave albuterol 5 milligrams and Atrovent 0.5 milligrams via nev treatment. After that, the patient, on re-examination after the first dose, the patient still remained tachypnic. Respirations were still in the 40s. O2 sat did improve to 91, so patient was placed on nasal cannula at 1 liter. A Decadron IV 11 milligrams was also ordered. And so for the diagnostic test, the chest x-ray was normal. For the lab value on the VBG that was done, the pH was 7.33, the PO2 was 32.5, the PO2 was 71.8, bicarb was 16.9, and the base excess was negative 7.7. For the CMP, the abnormal results, the potassium level was 3.4, the CO2 was 16, and the AGAP was 21.4. All of the other labs were within normal. The CRP that was ordered was within normal. It was 0.51. And so with all of the results to that, we did diagnose the patient with an exacerbation of reactive airway disease. So we did have the patient do another albuterol and nev treatment, the same 5 milligrams of albuterol and 0.5 of Atrovent. The patient's air movement did improve after that, but we were unable to wean the O2. And so we decided to admit this patient to the pediatric floor. We had consulted the PCP and he agreed to admit, and the patient was sent to the pediatric floor. After reviewing the case, I think one of the things I would have probably changed would be the chest x-ray. All of the other, the Atrovent, the short-acting beta agonist that we used, and the systemic steroids all followed the guidelines of the National Asthma Education and Prevention Program, which is from the U.S. Department of Health and Human Services. And they do recommend the short-acting beta agonist, the Atrovent, and then the oral systemic steroids if you need to, as well as O2 therapy. They did not, however, recommend the chest x-ray, and I think it might be more of just an ER practice that chest x-rays are just kind of automatically ordered. So if I had a patient present with the similar symptoms, especially one that had a history of asthma, I would maybe treat with the Atrovent, the albuterol, and the Decadron, reevaluate, see if there's any improvement before exposing the child to the radiation from the x-ray. Another thing we could have done if if we felt the patient was had severe respiratory distress, we could have given the dose of magnesium, which we did not do. But besides that, I think the patient did respond well to the treatment that we did have, and hopefully once he was on the floor, he had to stay like about a day or two, and then hopefully would have been discharged. But that's it for the patient in the ER. Thank you.